Brow lift treatment explained. I'm Dr. Kate Bennett-Brown and I'm a cosmetic doctor. Brow lift treatment is a treatment using Botox to create a lift in the brows. Exactly how we do this, where we place it and how much Botox we use depends on each person's anatomy and the results that they are after. When thinking about a brow lift, we want to think about the three main muscle groups which interact and affect the position of the brows, including their movement during facial expression. These include the frontalis muscle at the forehead, which lifts the eyebrows, the glabellar complex, which pulls the eyebrows down and medial, and the bicularis oculi muscle, which circles the eye and also acts as the main depressor of the eyebrows. We can tailor the treatment to focus on lifting the entire portion of the eyebrow across here, or we can tailor it to focus on lifting just the outer portion of the eyebrow, depending on patient preference. Now, if we want to create a really subtle brow lift, we can often do this by placing Botox just here and here at the superior portion of the orbicularis oculi muscle. This will soften the activity of it and create a really subtle lift in the eyebrow. The alternative option is to design a treatment which focuses on targeting the glabellar complex and the forehead muscle with Botox to create a more enhanced brow lift. Exactly how we place the treatment varies from person to person, but using me as an example, I will draw a vector line through the eyebrow where I want to create the lift, and then I will draw a line either side from the eyebrows. This area under this triangle is the area I'm going to avoid placing Botox. I'll then place Botox in the forehead and in the glabellar complex to soften the activity of the muscle here, which leaves activity of the muscle here still active, and this creates a really lovely brow lift. Patients often require a review at 2 weeks to see how much lift of the brow we've achieved, and if we are getting too much lift of the brow, we can then target some Botox around here just to soften the lift a little bit and create the desired effect that the patient wants. This is an example of a patient I treated for a brow lift. You can see after 2 weeks we've achieved a lovely natural, subtle lift of the brows when the patient is at rest. I'm Dr. Kate Bennett-Brown. Any questions about brow lift treatment, get in touch.